Hi, my name is Megan Zimmer, and this is our last week for our reflection and analysis on our reading. I do apologize for the delay, but this week we read about, last week we read about in chapters 8 and 9, just kind of how quality um, plays into overall an effective healthcare organization. One of the quotes that I loved from the reading was on page 171, which states, "Quality improvement is an essential component of an effective healthcare organization." This is actually a quote that I shared with my team this week. Just reiterating the importance of overall quality. Some of the main points of chapter 8 included external quality improvement, accreditation, quality improvement education, and things like certifications. Again, all huge things. With healthcare organizations, if you have any experience in healthcare, we all know that certifications and accreditation are huge. They help keep healthcare organizations accountable, up to date. They help us improve the healthcare organization as a whole, kind of keep the physicians accountable, and we can, look at, things like our external quality improvement, which is talked about on page 167, where it's the review of a physician or healthcare organization's performance by an external or outside body. So again, just having that accountability. This week we also learned a little bit about insurance regulations. A really common one that we read about is CMS, which is the Centers for Medicare and Medicaid Services. Really important. Medicare and Medicaid have a lot of strict rules and regulations. A couple of those reasons are, obviously to lower costs, but it's also hugely related to looking out for the benefit of the patients. One thing I found really interesting is, kind of how total quality management got started. We learned a little bit about the history in chapter 8 as well, about how in the 1990s, TQM, total quality management, became, really important part of our healthcare industry here in the U.S. Another couple of things that, I learned about and just did a little bit more research on my own was, as far as accreditation goes, there's the National Committee for Quality Assurance, the NCGA. There's also the URAC, which is Utilization Review Accreditation Commission. And then, of course, one that, we're a little bit more familiar with probably is the Joint Commission, which is the national accrediting body. Again, just learned a lot, again, about the importance of accreditation. Another thing that I'm super familiar with in my role, kind of how it applies to my workplace, is HEDIS. I used to deal with this a lot in my previous role and even more now in my supervisor role. But, it's a tool used by insurance plans to measure, the performance. So the performance on specific points of service to the POS. And, they have a public reporting and data collection, and then that data collection is also made public for people to view, which I think is, again, I think it's good. If I'm proud of the organization that I work for, I have no problem with them publishing that information. Then in chapter 9, they teach a lot about quality improvement and how physicians are required to get their CMEs, their continuing medical education, which I think is really big. They also in chapter 9 talk about the interfaces between quality improvement, law, and medical ethics. Essentially we learned in chapter 9 a lot of the ethical, moral, and legal issues that can arise in healthcare and kind of how government plays a role. One of the things that really stuck out to me was page 197. It says, "The concepts and tools of clinical ethics and medical quality management processes can be of value to resolving situations that are not well defined in the law or where legal opinion is unclear." I honestly think that's so huge. Quality management is so important because the law doesn't always make specific specific rules and regulations that we should essentially follow as healthcare organizations. We are held to a higher standard. We are caring for the livelihoods of patients. And so I thought this week was great. It kind of just wrapped everything up. And for me personally, it speaks a lot to my current role. And again, I just think that we've learned so much about the importance of quality and how it needs to be well integrated in our healthcare system. And this week, again, talking about how government plays a role and difference with ethics and government involvement and things like that. It was a lot of really great, valuable information. So thank you so much for a wonderful class. It's been such a pleasure, and I've learned a lot that I can take back to work on a daily basis. So it's been a really great class for me. Thank you so much, and that's all for this week's reflection. Thank you. Bye.